Hey guys, Tiffany Shank here. I'm hanging out at the office today, the Winchester office, and we're going to talk about monitoring in labor. We get a lot of questions about monitoring in labor, what to expect, what is normal. So I'm going to do my best to sort of answer those questions, but of course, if you're high risk or there's something else going on with your pregnancy, things might look a little different for you. So check in with your provider and check in with the nursing staff. So for monitoring during labor, like the basic point of that is to make sure that the baby is handling labor well. You know, how things are going and how baby is responding. It's one of our first signs often to sort of tell us how things are going. So if you're low risk and or you're planning to go throughout labor without an epidural, or you're planning to just see how long you can get, or you're planning to get an epidural at X centimeters, whatever it is that you're planning to do, movement in labor is really helpful to get things going and keep you comfortable if you don't have any other pain management options. So obviously, we have to find a way to monitor the baby while continuing to allow you to move around. So for most hospitals in our areas, they have a 40 minutes off, 20 minutes on protocol, which means for 40 minutes, you can be moving around, you can do whatever you want to do, you can get in and out of the shower for 40 minutes. And then for every 20 minutes out of an hour, you hang out by the bed, in the bed, whatever it is that you're doing, and they're monitoring the baby to sort of get a good reading. It's all clear, they take you off, and you go back to doing your thing. Occasionally, women need to be monitored continuously throughout labor, and if that's the case, ask for their wireless monitor, ask for the Monica Novi, and get that on because it's like when it works really well, and that can stay on. You can move, you can get in all sorts of different positions and do your thing, and they can keep track of baby really well throughout labor. So it's sort of a win-win for everybody. Occasionally, nurses I have seen, they'll use a Doppler, and that's the same thing that they use in pregnancy when they're listening to baby during prenatal care. And they'll come in and listen to baby for 20 minutes or for 2 minutes every 20 minutes. And I have seen that in a few hospitals, and of course, if you're working with a birth center or an out-of-hospital midwife, that's what they're going to be doing as far as monitor goes. So, if you have a specific question about where you're birthing, talk to your provider, call the hospital, see what their specific protocol is. But as far as, Inova Loudoun, Stone Springs, Winchester Medical Center, RMH, the 40-20 rule applies as long as you're low risk and they don't need to monitor you continuously. But it's always a good idea to check in with the staff and make sure that you're so low risk and you haven't switched to high risk and you don't need continuously monitored for whatever reason. And if you do, ask about your wireless options so that you can continue to move, you can continue to stay comfortable in the way that you want to stay comfortable, but then we're also keeping an eye on baby and making sure that everything looks good. So thanks for listening. Comment below if you have any questions, anything you want to talk about. We'll be happy to respond. So for more information about us, Virginia's for Doulas, visit virginiasfordoulas.com.